Nasal bleeding, also known as epistaxis, is a common condition that affects many people. It occurs when the delicate blood vessels inside the nose are damaged or ruptured, leading to bleeding from the nostrils. While it can be alarming to experience nasal bleeding, it is usually not a serious medical condition and can be managed with simple home remedies or medical treatment if necessary. Causes of nasal bleeding. Nasal bleeding can be caused by a variety of factors, including dry air, allergies, sinus infections, nasal polyps, high blood pressure, and injury to the nose. Dry air is a common cause of nasal bleeding, as it can cause the delicate tissues inside the nose to become dry and cracked. This can lead to nasal irritation and inflammation, which can result in bleeding. Allergies and sinus infections can also cause nasal bleeding, as they can cause inflammation and swelling of the nasal tissues. This can cause the blood vessels inside the nose to become more prone to rupturing or bleeding. Nasal polyps, which are small growths inside the nasal cavity, can also cause nasal bleeding if they become irritated or inflamed. High blood pressure can also be a factor in nasal bleeding, as it can put pressure on the blood vessels inside the nose and cause them to rupture. Finally, injury to the nose, such as a blow to the face or a foreign object in the nose, can also cause nasal bleeding. Treatment for nasal bleeding. Nasal bleeding can usually be managed with simple home remedies, such as applying pressure to the nostrils or using a saline nasal spray to keep the nasal tissues moist. If the bleeding persists or is severe, medical treatment may be necessary. One common medical treatment for nasal bleeding is cauterization, which involves using a small electrical or chemical probe to seal the blood vessels inside the nose. This procedure is usually done in a doctor's office and takes only a few minutes to complete. In more severe cases, surgery may be necessary to address the underlying cause of the nasal bleeding. For example, if nasal polyps are causing the bleeding, surgery may be needed to remove them. If high blood pressure is the cause of the bleeding, medication may be necessary to bring the blood pressure under control. Preventing nasal bleeding. There are several steps you can take to help prevent nasal bleeding. These include keeping the nasal tissues moist by using a saline nasal spray or humidifier. Avoiding picking your nose or blowing your nose too forcefully. Treating any underlying medical conditions, such as allergies or high blood pressure. Avoiding exposure to dry air or irritants, such as cigarette smoke. In conclusion, nasal bleeding is a common condition that can be caused by a variety of factors. While it can be alarming to experience nasal bleeding, it is usually not a serious medical condition and can be managed with simple home remedies or medical treatment if necessary. If you experience frequent or severe nasal bleeding, it is important to seek medical attention to determine the underlying cause and receive appropriate treatment. By taking steps to prevent nasal bleeding and managing it promptly when it does occur, you can minimize discomfort and reduce the risk of complications. Thanks for watching. Please hit the subscribe button to stay connected to everything that matters to you about your health.